Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we'll be doing a so-called hyper-personalized, customized Ultherapy treatment. Folks, let's welcome back Dr. Patricia Nicole.
Hello po, hi. So happy to be back here.
Yes. In the past, we've done treatments for Doctora, the so-called Hyco three-way technique, the under eye treatment or enchanting eyes, and we did also the so-called perfect V using our injections of Predis on the chin and then volume on the cheek area as well as the Xeomin for the masseter area. And today, we'll complete the treatment, our treatment package for you, the Ultherapy treatment. Okay, so a while ago we were discussing about the shape of the face, the sides, the left and right sides. So Doctora told me that on this area, the right side, she has more of the nasolabial fold here. And then on the opposite side, correct Doctora, right? You have this concern here. And then on the left, so there's more of a volume on this lower aspect of the face or the lower cheek region. So in our Ultherapy approach, we can do the so-called customized, not following the standard that they have that you do equal shots on each side, but we can somehow do a procedure that will target those concerns. So we want this nasolabial fat compartment here to be targeted, and we also want to target the buccal fat region here using our different transducers of our Ultherapy. So we have different of those tips. So they have different depths. There's a 1.5, there's a 3, there's a 4.5. So if you want to reach the so-called SMAS or fibrous layer, we can make use of either the 3.0 or the 4.5. And if you just want to reach the dermal fibroblast layer, you can reach the 1.5. So you also have to assess the thickness or the volume of the tissues of the face. So for people with thinner tissue coverage, we can make use of just the 1.5 and the 3.0. If there's a thicker tissue coverage, 3.0 and 4.5. Makes sense, Doctora? Kasi we have to make the face balanced and symmetrical. So we wanted to work on this nasolabial area here for this side, and on the opposite side, more of the lower cheek region. So in our Ultherapy treatment, we always have to follow those markings that we initially do. Okay, so this area we have to avoid because there's this branch, the marginal mandibular branch from the facial nerve. And if you wanted to follow the inferior border here, the mandibular line, and just make those transverse lines like that, so that's the usual or the standard method that we do. So for area, we give like certain shots, number of shots, and we'll just modify that. We'll customize the treatment for Dr. Patricia. We'll show you when CSA Medical Aesthetics return. And we're back. We will now do the hyper-personalized Ultherapy treatment for Dr. Patricia Nicole. So on the right side, we've been talking about the asymmetry of the face. So there's more of the nasolabial fold here. And we'll be working on this aspect here using our 3.0 millimeter with a 40 number of shots. And then this one here, same thing, 40 number of shots. And on the posterior aspect, 15 number of shots. So in our so-called SPT or C-plan treatment right now, this is how we do our procedure for Ulthera. We have to assess them first, and then we have to make our plan of our treatment. You can actually visualize the tissue layers inside. If you look out our screen there, so it has the ultrasound. So you can see the epidermis, dermis, subcutaneous layer, and then the SMAS layer. So actually with the 3.0, you can see that I'm in the subcutaneous layer. Okay, so I wanted to also target that fat layer, so there will be a kind of fat reduction also. Right, Doctora? Okay, so that is part of the C-plan treatment. So when you plan your treatment, you can now dictate the number of shots that you will be applying in certain section of the face. So when you also check on the left side, a while ago we were mentioning that the left has this more of a bulge on this lower cheek of the face. So we can check at the lower cheek, you can see there. So So this part here, the 3.0, you can see that the subcutaneous layer, but I wanted to reach the mass layer, the 4.5. So on this part, I'll be using the 4.5 millimeter transducer. So it will be a so-called customized approach. Okay? So in our record already, we have the so-called chart there where we write down the number of shots. This is part of the planning. And then after you have planned your treatment, you can follow those number of shots and you can start giving your Ulthera clicks or lines. Okay? So again, avoid this part here where you have your marginal mandibular branch and you follow this width of this transducer here. So I'll start this section here and I can give a 0.35 energy. Okay, first shot. How's that, Doctora? It's okay, right? It's a tolerable procedure. We actually numb the skin with our topical lidocaine, so you can leave it for about an hour to just reduce any discomfort when you're doing the procedure. So I've mentioned that we'll be doing 40 shots in this aspect here, so we'll just be continuing with our delivery of the Ultherapy lines. The 3.0 on the right, then 3.0 transducer, we're changing to the 4.5. So this is a customized approach since we have this bulge of the tissues on the left lower cheek. So I use now the 4.5 millimeter to target this mass layer. So we have here the lower portion here to be targeted by our 4.5. So this is part of the customized approach, and we'll be giving shots on this part here, like about 30 shots of the 4.5 depth. And then the upper section will also use again the 3.0. We'll go back the 3.0. So it's important that you have to assess the thickness of the tissues and be able to give the right number of shots. So as you can see in the screen, I am at this mass layer there on the 4.5 millimeter depth, and I am working on the deep buccal fat tissues here as well as the deep middle cheek fat pad to be able to reduce those too much of the tissue volume and balance the left and right and be able to give that symmetrical face. Later on, we'll also combine with the 1.5 millimeter to target the dermis and stimulate the fibroblast cells. And we're back to the 3.0 for the upper portion of this medial section on the left side area. And we're proceeding with the remaining 20 shots for this side here and using our 3.0 millimeter depth. So this is our customized approach for Ulthera. Again, it's not a one size fits all, so treatment should vary depending on each individual. So it's a so-called hyper-personalized treatment, individualized treatment to be able to deliver an optimal outcome. Proceed to the 1.5 millimeter depth of our transducer of the Ulthera. So right now we'll work on the under chin region. So the reason why I am doing or using the 1.5 millimeter is to reach the dermis layer. I wanted to stimulate the fibroblast cells to synthesize new collagen materials. And so I'm working on the under chin. So I wanted to prevent the sagginess of the submental region. Okay, Doctora? So we'll do shots here. So we'll be using like about 30 shots of our 1.5 millimeter here. For some people, we also use the 3.0. It depends on the thickness of the tissues. So for Doctora, it's not like she has this thick submental fat. So we just wanted to reach the dermis layer to stimulate the synthesis of your collagen and elastin. So we're trying to prevent any sagginess in that region. So this is a very good prevention treatment. Last time I did my neck rejuvenation, I also used Ultherapy on my neck area to be able to target those sagginess and as well as those deep neck lines. Okay, so it's a tolerable procedure, Doctora? Yeah, because others are afraid of Ulthera because they were saying that it's very painful, but I could say this is a very tolerable treatment. You will feel some of those tiny pricks, that's normal. Those are the energy pulses from the Ultherapy machine. And so far, it's very tolerable. Okay ka na, Doctor? Okay, so, we're working on the submental area and reaching the dermis layer. So, we are in the second layer of our skin, the dermis. Working on the right nasolabial fold, so I wanted to give an instant lift here. I'm using the 1.5 millimeter depth, and it's the dermis layer. Again, I wanted to stimulate this elastin and collagen formation in this layer of the skin. So this is the 1.5 millimeter depth, a customized approach. Part of my customized treatment is to still improve this midsection here using my 1.5 millimeter depth. So I am targeting the dermis section, second layer of the skin, and we want to stimulate the fibroblast cells to synthesize our fibrous protein tissues. And also targeting the deep dermis so that there will be like somehow the border between the dermis and the subcutaneous layer will still be targeted. A while ago, we used the 4.5 millimeter to reach the subcutaneous fat and the deep fat pad. We wanted to slim this part here and give that symmetrical result. Done the hyper-personalized Ulthera treatment for Dr. Nicole. Will show the result when CSA Medical Aesthetics return. And we're back. So let's now show the result to Doctora, and here's our mirror. So the post-Ulthera treatment, hyper-personalized, customized approach using the C-plan treatment procedure.
Doc,
yeah.
I'm really happy with the result.
I know.
Because your approach, Doc, it really targets my concern,
yes.
which is this, the
nasolabial, right,
and
yeah.
my concerns here.
Yes,
so
on the left lower cheek,
I'm really
right.
happy, Doc.
Thank you
so much.
The wonderful thing with this one is it has no downtime. So look at that, there's no like mark from the Ulthera shots, no bruising, because it's
not painful.
And it's not painful. So this kind of treatment, no needles, okay? So no marks of those. Like for example, whenever we do injections, last time we did injections, chin, cheeks, and then this part here, the masseter. So there were like tiny needle injections, but this one, no needles. Okay, it's painless, and I could say it's for the others, okay, with low pain tolerance, something like that, and but however, it's still tolerable. Okay, no downtime. Okay, and I could already see a result.
And Doc, your approach is way better kasi like what you said, the normal approach, just, parang same.
Same,
But
yeah.
your approach, you really target yung concern ng patient, which is yun talaga.
We wanted to correct also any asymmetry or imbalance of the face. And this is part of the so-called perfect V treatment. If you really wanted to have a V, contour V shape, because we did already the chin filler, cheek filler, plus the masseter reduction there. We made use of the botulinum toxin here and hyaluronic fillers here. And we completed it with our Ulthera treatment. So for others who are asking why start with the injection before the Ulthera, these are approaches that you could like begin with the Ulthera first and then the injections. But with her, because it's like a more of a hyper-personalized treatment, I targeted the areas that we needed to work on, because when I did the chin injection, it was just here, and then the cheek injections, more of this side here. We did not like pass through that when we were doing the Ulthera, so it's an okay approach. Thank you so much, Dr.
Thank you so much,
Patricia
Doc.
Nicole. We're so happy that we are achieving this kind of V contour, the V shape right now. And of course, we wanted a procedure that's non-surgical and would only give us natural result. And it is still you.
Yes.
Yeah.
Thank you so
Okay.
much, Doc.
And in addition to that, actually in 3 months' time, you will still see effects or further improvements. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-426. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.